Welcome to AM Business. That's our business segment here on the AM show every Wednesday. It's brought to us courtesy EcoBank, the Pan-African Bank. Now, the coronavirus continues to have a grave toll on the world's economy with cancellation of flights and distortions in exports to China. Already, the World Health Organization has warned that developing economies like Ghana could suffer a huge toll if preparations are not intensified. In today's AM Business, we assess the preparedness of our business community against COVID-19.
Every day, thousands of people ply Ghana's main airport, the Kotoka International Airport. But there's a threat: the outbreak of the coronavirus, which has left the world in a panic. Reports that we have so far indicates that the death toll for this particular disease in China is at 26, and over 830 persons have also been affected within the same country. Subsequently, the disease is reported to have spread out to about 8 other countries, which has caused some amount of alert globally on how to check and curb the spread of this new deadly virus. Already, neighboring Ivory Coast has reported its first suspected case of the coronavirus, leaving questions about how prepared Ghana is in containing the virus. We put these questions to the head of port health at the Kotoka International Airport, Gideon Akwe. So far here at Kotoka Terminal 3, has there been any suspected cases or have you had any issues so far here at the Terminal 3?
No, there's no suspected case as at now.
So for now, though, what are the protocols in place to check the passengers that are coming in to ensure that we don't have any incidences?
When they come, we have the health declaration form. This is the form we give to all the travelers or the passengers. We give to the travelers or the passengers to fill at the upper arrival before getting down to the screening points. We have thermal scanners. So after filling the form, when you go to where the thermal scanner is, the thermal scanner will pick your temperature. When your temperature is above the threshold, that is, when it is above 37.5, we have a light in the thermal scanner. It will show red. So when it shows red, quickly we have an officer who will politely ask you to get aside the queue. The officer will interview you. Then we use this non-contact thermometer to re-check your temperature again. If still it is above the threshold, we have F-team here. We have the port health, airport clinic, and the ambulance. So quickly we have to inform the airport clinic, the ambulance. Then we also have to inform the international health regulations focal person.
In terms of, let's say, in terms of isolation units, in terms of even ambulances and equipment, are we planning to add up more just to ensure that we are really on point?
Here we have 2 ambulances. And at Rava Hall, we have 1 holding room there. Airport Clinic 2 is also having another holding room. So here, when there's a case, we will not allow you to enter the port. Holding room, we have entrance to the tarmac. So ambulance will just pick you at the tarmac straight to the clinic to reduce the spread or the infection.
The team was granted rare access to the arrival section of the airport. Here we noticed something unusual. Customs and immigration officers were all in protective gloves and nose masks.
We were given directives from our commissioner and the sector commander, Madam Molly Awaji, that we need to intensify our protective measures here.
Chief Revenue Officer in charge of Terminal 3, T.D. Williams, explains the high alert rate of officers at the airport since the outbreak of the coronavirus.
Wearing our gloves, as you've seen, and mouth mask. In addition to that, we make sure that even the goods that we handle, whether passengers are with them or not, we at least wear our hand gloves to ensure that we are protected. After that, officers are required to take some kind of hygienic measures, wash their hands. And as you can see on the table, we have the hand sanitizers, we have to use it periodically.
Are you by any chance fumigating or anything of that sort to check some of these things coming in?
Yes, the airport authorities are always regularly fumigating. I believe they are taking immediate measures. The port health authority officer came to me this morning and assured me that they are going to fumigate the areas where we work.
Barbara Sam is the Assistant Superintendent of Ghana Immigration.
So Ghana Immigration Service, this is a health issue, so the Ministry of Health is handling this. But for us as a service, we have put certain measures in place to prevent our officers from getting this virus. And the measures are, we've provided them with face masks, we've given them gloves, and then we've also told them to wash their hands regularly, and then also look out for symptoms when passengers arrive and report the passenger immediately to Port Health, and also to be alert. That's all.
Despite these measures, however, some still argue that passengers traveling from China should be quarantined and rigorously screened at the airport. So from the strict and thorough checks of passengers by the thermal scanners, as well as the port health authorities, and the wearing of protective gear such as the hand gloves and the nose mask, and the presence of hand sanitizers on almost every desk here at the airport, one can say that the stakeholders and authorities here at the Kotoka International Airport are on the beat and have stepped up measures to ensure that everybody is safe and this coronavirus does not cross our frontiers. Meanwhile, on the global front, with regards to air transport, the International Air Transport Association, IATA, has issued a statement that it is monitoring the situation. The statement read, IATA is closely monitoring developments related to the coronavirus outbreak in Wuhan, China, and is actively engaged with the World Health Organization Secretariat, ICAO, and the U.S. Centers for Disease Control. WHO is advising measures to limit the risk of export or import of the disease without unnecessary restrictions on international traffic. Airlines are prepared to work with the public health authorities when there are outbreaks of communicable diseases with well-developed standards and best practices. As the fears of contamination from travel linger, some traders and importers who source their wares from China say they may halt travel in the interim, which they fear could hike prices of goods.
I'm not going to China anytime now, and I don't know when I'll be going, but we import. It's safer. You know, I can't go there to see the goods for myself. So definitely, one way or the other, I'm not going to have 100%. I'm not 100% sure doing business with them, because when the things come, whatever is inside, I have to adjust it. But if I'm there to buy, it's a different ball game. So definitely it's going to have an effect on my business.
Because of the lockdown of some of these, 17 places in China, definitely it means goods will not be coming into the system, into Ghana. And as a result of that, it will create some shortage, and that shortage may lead to some price hikes. And that will be the impact that we anticipate, at least for the immediate future, because these things are not planned for. So you cannot just take immediate, you cannot have immediate response and then sort of salvage the situation. It's not going to be that easy.
People who have enough goods at their warehouse have the edge now. But if your goods is on the way coming and it's being locked, then you are on the other side. But I think the scary bit of it is when we hear that about 9 countries in Asia have now got the disease. Then it is scary. It is scary. So I think something needs to be done.
Deputy Trade Minister Carlos Ahenkra also cautions traders to be extra careful during this period.
Of course, I've heard and I've seen on the media landscape what is going on in China, but I wouldn't have any evidence to support. But however, you can't take some of these things for granted. I will take opportunity of this engagement to inform our traders that they should be careful. Those who intend going to China, I would say just watch where you go and let's be careful how we interact. Even though I think they seem to have the situation under control, you know that when it should come to our part of the world, it will be very, very disastrous. Unfortunately, I hear that it is spreading more than we thought. cases have been reported in the U.S., South Korea, and so on. And even as close as Cote d'Ivoire, we hear that there's some cases that have been detected in just next door, which doesn't spell too good for us. So let us be careful how we go around some of this information when we hear them.
As efforts continue on how to contain the virus, Hong Kong on Tuesday implemented a broad series of restrictions aimed at controlling the spread of the coronavirus, including limiting the number of mainland Chinese travelers entering the territory, one of Asia's busiest travel and financial hubs. Global stock markets on Monday also took a sharp downturn as investors grew increasingly anxious about the swift spread of the coronavirus beyond China.
We know the death toll in China now has gone past 2,000. So just take the precautionary measures. And that's it for AM Business today. I hope that you did enjoy this one. It's brought to us by EcoBank, the Pan-African Bank. We do this every Wednesday right here on the AM show. Now, after this, we settle down for AM Talk. Our guest this morning is Member of Parliament for Sekondi, Andrew Ejapa-Mensah. Also, Murtala Mohammed is a former Deputy Trades Minister, a former MP for Nandom, and now parliamentary candidate for Tamale Central on the ticket of the NDC. It will be a very interesting conversation, analysis of all the topical issues in our country today. Stay with us.